I would like to gently remind everyone and the participants to utilize the Q&A chat function to input any questions you have. So with that said, I would like to introduce our interpreters to support non-English speaking community members to access the translation function. So with that said, I would like to introduce Frida with Spanish.
Buenas tardes a todos y gracias por acompañarnos. Bienvenidos a este diálogo comunitario del Condado de Sacramento sobre el COVID-19. A efecto de proporcionar acceso lingüístico, esta reunión contará con interpretación simultánea bidireccional al inglés y al español. Si usted es bilingüe, no tiene que presionar nada, pero si usted no es bilingüe en inglés y al español y está en su computadora, por favor localice el icono en forma de globo que en unos minutos aparecerá en la parte inferior de su pantalla, haga clic en interpretación de idiomas y después seleccione español o Spanish. Si usted está en su iPad o su teléfono o un dispositivo similar, en unos segundos abra su menú de 3 puntos que está en la parte superior derecha de la pantalla, haga clic en interpretación de idiomas y después seleccione español o Spanish. Si tiene alguna pregunta o comentario, le pedimos que la coloque en la parte inferior de su pantalla en la caja de preguntas y respuestas o Q&A y obviamente lo puede hacer en el idioma de su preferencia. Gracias. Thank you.
Thank you, Frida. Next, I have Alexander with Russian.
Добрый вечер и добро пожаловать на очередную встречу через интернет в форме семинара общественного собрания округа Сакраменто, посвященного пандемии коронавируса COVID-19. К вашим услугам переводчики русского языка. Пожалуйста, чтобы доступиться к переводу на русском языке, нажмите на кнопку с изображением глобуса и выберите русский язык. Для тех, у кого имеется планшеты или мобильный телефон, iPad или мобильные телефоны, услуги перевода – это в меню, которое изображается в виде 3 точек в правом верхнем углу. Там выберите услуги перевода соответствующего языка. К вашим услугам также гарнитура вопросов и ответов. Вы можете печатать вопросы на родном языке, они будут переведены. Большое вам спасибо за внимание и приятного прослушивания.
Thank you. Next, I have Miguel with Tagalog.
Hello, magandang gabi po sa inyong lahat. Ito po si Miguel, Tagalog na tagasalin. Ano po, malugod na pagtanggap sa bawat isa sa inyo. Salamat sa inyong pagdalo dito po sa ating usaping pangmamamayan. Ano po, ito po ang pampublikong kalusugan ng lalawigan ng Sacramento. Ano po, tayo po ay nagtipon para po pag-usapan ito pong COVID-19. Ano po, tayo po ay magkakaroon ng talakayan. Paunawa lang po, paalala lang po, kung gusto po ninyo na makapakinig sa wikang Tagalog, puntahan lamang po ano po yung litrato ng mundo at ito po ay pakidiin. Pagkatapos po ay doon po sa baba ay pakidiin po yung wikang Tagalog at doon ay maririnig po ninyo ang ating lingwahe. At paalala lamang po magkakaroon po ng tanungan at sagutan. Kung meron po kayong mga katanungan, pakilagay lamang po ito. Ano po ang ating po mga magsasalita, yung mga manggagamot na si Siri Rachel Allen po at si Dr. Cohen ang sasagot po sa inyo po mga katanungan. Pakibigay lamang po ang inyong mga katanungan. Salamat po.
Thank you. Next, I have Laura with Mong.
nhớ rằng trong xe tại tòa tan trò cho nên chỉ cái tin cha này sẽ là mà nó là cũng phải lưu trong xe thẳng nhất trong Sacramento cho tụi các mất về của chúng nó mà nói cho hai tiền này từ xã tàu lồng mong xài nó chỉ thọ này nhảy cho họ lúc luôn họ cá New York khi hai tiền nhảy mong nó nên thế lý luận cả tàu trong lúc họ do hai tiền này cũng phải nhón cho họ iPad và xe iPhone nó chỉ thọ này một trong họ mình nhớ cho sổ sa xì nhảy bay lú tỉnh nhớ cho sổ chỉ nữa cho nên một trò bay lú không còn bây giờ xài lú tàu cho nên một nó nào và trong tàu này là cũng phải một nó.
Thank you. Next, I have Tam with Vietnamese.
Xin chào mừng quý vị tới diễn đàn cộng đồng về COVID-19 được tổ chức bởi Cơ quan Y tế Cộng đồng quận Sacramento. Để sử dụng tính năng thông dịch, xin quý vị làm ơn bấm vào biểu tượng quả cầu ở phía dưới màn hình Zoom của quý vị và chọn tiếng Việt tức là Vietnamese. Và để đánh vào câu hỏi vào phần hỏi đáp thì xin bấm vào nút Q và A cũng là ở phía dưới màn hình của quý vị tức là hỏi đáp và đánh vào câu hỏi của quý vị. Câu hỏi của quý vị có thể sẽ được trả lời bởi các chuyên viên y tế. Xin cảm ơn quý vị. Thank you.
Thank you. Next, I have Angela with Mandarin.
嗨，你们好，欢迎来到我们12加冕度的这个冠状病毒的健康讲座。我们今天晚上将为你们解决你们的问题，欢迎你们放在我们 Q&A， 如果有各方面有关这个病毒的问题。另外，我们也欢迎你们需要翻译的时候，请你们到我们的这个中文同步按键进去，那么我就会为您做同步的中文、英文翻译。谢谢您 ，Thank you。
Thank you. And last, I have Ahmed with Arabic.
مساء الخير، أهلا بكم في مؤتمر الكوفيد 19 في ساكرامنتو. اليوم المتكلمين هيتحدثوا عن آخر التطورات في هذا الوباء، وستتاح لكم الفرصة أن تقوموا بتوجيه أي أسئلة لكم على للمتحدثين. كل اللي عليكم انك تضغطوا على تحت في اسفل الكمبيوتر او الايفون على العلامه بتاعت الكره الارضيه وتسالوا سؤالكم، وانا ان شاء الله هنترجمه للمتحدثين. واهلا بكم في المؤتمر، ودايما ان شاء الله تستفيدوا، تكون فتره ظريفه وكويسه. ومعكم اخوكم احمد مخيمه. شكرا.
Thank you so much. And now interpreters are going to be into the in the global interpretation. So community folks, please utilize that interpretation if you would like to utilize or hear it in a different language. With that said, welcome everyone to our COVID-19 community forum. My name is Mike. I'm with the Sacramento County Public Health. I have the pleasure to introduce our guest speaker today, Dr. Stuart Cohen, who is a medical director of the Department of Epidemiology and Infection and Prevention at UC Davis Health. And with that, I also have the lovely honor to introduce our public health officer, Dr. Olivia Cassirier, and my colleague, Rachel Allen, the immunization coordinator. So with that said, I'm going to pass it over to Dr. Cassirier.
Good evening, everyone, and thank you again for joining us. So I'll give a very brief update on our numbers and then turn it over to Rachel to talk about vaccination, and then we'll have Dr. Cohen talk about the medical aspects, and then we'll go into questions. So with the numbers, we are at 97,883 cases of COVID-19 reported in Sacramento County to date, and the deaths are 1,610. With the cases, we're averaging about 120 to 130 cases per day. According to the state blueprint, which is the numbers that we use for determining what tier we are in, according to the update this week, we are at 7.4 per 100,000 case rate and positivity at 4.2. That puts us in the red tier according to the blueprint. One of the things that has happened lately that we have noticed in the last week or so is that there's been a slowing down in the decrease of cases, and actually in some of the days we were going in the wrong direction, the numbers were increasing. And we noticed that a lot of that was due to cases that we were getting that were related to youth sports. So we have been dealing and working with the schools and coaches and reminding parents that if their students are feeling sick, however mild the symptoms are, that they keep them home, because what has happened oftentimes in these situations is that you have a player who has some mild symptoms and doesn't feel sick enough to stay home, so decides to go for the game, and they have the huddle in the locker room. And so this leads to a large number of the players being exposed. So a reminder to players and to parents that they need to, if the student or the player is feeling sick, that they should keep them at home. One other thing that we would like to remind folks of, we know that this weekend is going to be Easter Sunday. A lot of people are planning to go to church. So we ask that you remember to continue with the preventive measures that we have been advising, which is using a face covering 6 feet away from others that are not of your household, and avoid gatherings. And if you are feeling any symptoms, please stay home. We know that some people might be planning to have an Easter egg hunt. We prefer that those kinds of activities occur outdoors where the risk is lower and it's easier to keep people separated. Lastly, I wanted to bring to your attention a report that came out recently from the Centers for Disease Control that states that the numbers show from 2020 that COVID-19 was the third leading cause of death next to heart disease and cancer. So this just shows you the gravity of what we have been dealing with. I think we're at a good point now where we are seeing the numbers reduce, and we also have a vaccine available, which is going to help us to get through this and get to the point where we can finally start releasing or relieving some of the restrictions. So with that, I'll turn it over to Rachel to talk about our vaccinations and where we're at.
Hi, good evening. I'll just give you a brief update. I'm the immunization coordinator for Sacramento County Public Health. And this week, we received our allocation numbers. It's going to be 33,000 doses. That's 11,700 doses of Pfizer vaccine, 9,200 doses of Moderna, and 12,100 doses of the Johnson & Johnson vaccine. So that was a big increase for us this week. Very encouraging news. And we do expect those numbers to stay about that same level, we hope, for the next few weeks. And I don't know if you can bring the dashboard back up, Mike, but we do also have the vaccinations on the dashboard. So very encouraging for everyone, I hope. And this is just updated once a week. So last Friday, 583,080 doses of COVID vaccine had been administered here in Sacramento County. So, and that map shows you where the clinics and sites are that we have that are currently operating to reach our community. This is the first week that I think in past weeks when I've been here, we've talked about transitioning to Blue Shield. And so this is the first week that we worked with Blue Shield to make the allocation to providers. And Blue Shield did the allocation to some of the providers that have contracted with them, and then public health allocated to the remaining providers. And that'll happen again next week. And then the hope is the week after that, everyone will have transitioned to that network, and Blue Shield will be making the allocation to the Sacramento County providers. Big change today in eligibility, kind of exciting. Starting today, April 1st, people 50 and over can be vaccinated. And if you live in Sacramento County and you're over 50 and over, you can be vaccinated in Sacramento County. There's our phases. Vaccinating now, we're in phase 1A still, always, working to capture people that we may have missed or people who've changed their mind. And then also phase 1B, still working with that population as well. So that's 65 and over, some occupation-based sectors there. And then now we're vaccinating, 50 and over, and we're still vaccinating 16 to 64 with the high-risk medical conditions. So big news, and we know that that means there's more people competing for appointments, and just still encouraging people to be patient. And we have more doses this week. We have more providers onboarding, so we're continuing to try to meet that demand. And our website is really the best place to find those sites that you can go to. We keep it updated, and we put pop-up clinics and links to various sites, pharmacies, and hospitals, so that you can look for appointments, and you can get on there every day and hopefully look around and find something. April 15th, we will open to 16 and over. So that will be another big change for Sacramento County. And we are reminding people that the Pfizer vaccine is the only vaccine approved for children's ages 16 and 17. So right now, until things change, that's the only vaccine that population can get. So when we do enter that on April 15th, if you have a 16 or 17-year-old, or if you're watching and you're 16 or 17 and making your own appointment, please be sure that you go to a Pfizer site. And then I'll just touch, we are continuing to run Cal Expo. I think we probably mentioned, I wasn't here 2 weeks ago, but we probably mentioned that we are transitioning to a different provider. It will continue to operate, but with someone else operating it. We are still running those second doses. So if you had a second dose at Cal Expo, A first dose, I'm sorry, you will get an invitation for a second dose appointment, and we are following those out. And if you feel like you've missed that somehow, or we end up transitioning over and you didn't get your second dose, you can email our COVID-19 vaccine email address to inquire about that, and we'll help you find that appointment. We did decide, because we got more Johnson & Johnson vaccine and because we opened up eligibility so much more, we did decide to run some first doses there. So we are running some Johnson & Johnson clinics until we phase out. So we'll still be doing second doses for Moderna, but we'll also be doing some Johnson & Johnson, and that's a one dose. So it makes it easy. We won't have to follow people for the second dose. We can just give them the one dose and they're done. And I think that's it for me. So I'll turn it over to Dr. Cohen if he has more to add.
Yeah, I'll be brief. Hi, everybody. Just to reintroduce myself, I'm the one person on this call that doesn't work for Sacramento County. And I work across the street at UC Davis. In the hospital, we have been seeing a downtrending in the number of patients until this weekend, or this last weekend, and then we saw a blip back up again, which looks like it's starting to come back down again. But our numbers right now, we're sort of where we were in a year ago when we thought it was our first wave of cases. So not like it was when we really had our big surge, but we still do have a significant number of people in the hospital. We are engaged in trying to do some studies, or at least we're trying to get funded to do some studies on the long-term COVID patients. That seems to be a significant percentage of the population now that are still having symptoms months after getting infected. And again, I think since a lot of this forum is designed to discuss vaccine, I think I continue to emphasize the fact that even though there may be some transient side effects with the vaccine, it's nothing like getting COVID-19. And even people who survive COVID-19 without a long, painful hospitalization do end up with long-term complications. And it really can be a major life changer. And again, even for people who survive. So I think that you have to be very thoughtful about what you're doing and really understand that vaccine is the ultimate way out of this pandemic. And the transient problems associated with it are transient, and a lot of this other stuff is permanent. So be thoughtful about that.
Thank you. And with that said, I'll start our evening off with the first question from community member. A community member asks, if someone loses their vaccination card, what should they do?
I can take that one. We do get calls and emails about that. We encourage people to try to go back to the provider that they received the doses from. I think that's the best place to try to get if you truly want a replacement card. But it's also possible to just download your doses from the California Immunization Registry. So that's another option. And if you have trouble with that, again, you could email our COVID-19 vaccine inbox. But I think we can help you.
Have all the vaccines gone through the same clinical and other trials that other vaccines have gone through?
Yeah, so this has been one of the questions that keeps coming up, that these vaccines were developed rapidly, and so people were cutting corners. There are no corners being cut. Every one of these trials have been at least 30,000 people. The Pfizer trial was 43,000. I think Johnson & Johnson was about 40,000 and Moderna was 30,000. And we're still finishing up a trial with a Novavax vaccine that also had 30,000 plus people in it. Because we're in the middle of a pandemic and the number of cases accumulate more rapidly, it's easier to get to endpoints sooner, right? The way that a vaccine efficacy is identified is by comparing the vaccine to placebo patients and seeing how many patients in the vaccine group get infected compared to those who are in the placebo group. And once you hit a certain number that is predestined or predefined for statistical analysis, you can do those analyses. And so these vaccines can be tested and analyzed more rapidly because the number of cases accumulates so much more rapidly, and they can demonstrate the efficacy. As far as long-term safety, all of these trials require people, or at least request people participate for 2 years. So the long-term safety data are not yet available. But the short-term safety is available and the efficacy is available. So I don't think any corners have been cut. These, you can see how with the AstraZeneca vaccine that they've struggled their way through things. They haven't even got to the FDA yet. And so I think that some people have argued that in the middle of a pandemic, the FDA has actually been too tough on it. I think that this is pretty standard operating procedure for vaccines.
So on that note, Dr. Cohen, another community member asked, the Pfizer vaccine for ages 12 to 15 has been shown to be 100% effective in preventing the virus in age range. Is there any information on when the Pfizer 12 to 15 or also Moderna under 12 will be approved for use and available?
Yeah, so the Pfizer vaccine, right, was reported in the press, and if you sort of look back at how this worked with the adult stuff, they have to do more analyses and put more things together. My guess is that they might be able to go to the FDA in about a month, which would mean the earliest timeline would probably be sometime in June when it would be available. They may be able to move things along a little bit faster than that, but that's probably a fair estimate of when you might start seeing it in kids.
For someone who's fully vaccinated, how confident can they be that they will not transmit the virus to family and friends who have not been vaccinated?
So I think you can be reasonably, but not 100% confident. And that's why we continue to send the message that particularly if you're with people who are high risk and who have not been vaccinated, that you continue to wear masks even if you've had 2 doses of vaccine. I think probably the best information that we have on this comes from a study that was done in Israel, where they had vaccinated a significant percentage of their population. And by 2 weeks after the second dose of Pfizer vaccine, and that's what was studied in that analysis, there were few positives, but not zero. It was like 0.19%. So it's a really small number, but it's not zero. And I think the CDC also just put out a morbidity and mortality weekly report that I think is dated for tomorrow that shows that it's about 90% effective at preventing infection. It's 100% effective or 94% effective in preventing disease. So it's almost exactly the same, but not exactly the same. So I think if you have symptoms, you still need to be tested. And if you are in contact with somebody who's not vaccinated, you should still use distancing and mask wearing as part of the safety protocols.
Have any COVID-19 cases been attributed specifically to air travel?
That's hard to say because we do ask about travel, but because the infectious period is 2 weeks and the incubation is also 2 weeks, it's kind of difficult to be able to tell when exactly someone got exposed and infected. When we do get notified about exposures in airlines, we follow up. But again, it's hard unless the person is sitting right next to and they have extensive exposure.
What is the current best way to obtain an appointment for vaccine once eligible?
I think the best place to find the most comprehensive list of sites is going to be the Sac County COVID vaccine website. It has a link embedded in it that takes you to a site that has all of the various options that we know of, and we're continuing to ask providers to give us insight into whether they're holding clinics or if they have capacity to add people. So I don't know if we can put that website back up, but or the link in the chat. I think it was already in there, but that's a good place. If you have a primary care doctor, you can also start, with them, certainly. And we're trying to get more and more vaccine out into providers' offices.
One thing I would like to add too is that we are in partnership with 211. So folks that are facing digital barriers or might have access barriers, please feel free to call 211. We're partnering with them to kind of see ways in which we could carve out, and they provide multiple languages to help address some of those accessible barriers too. So going back to the question, one community member saying, what is the pathophysiology of COVID-19? In other words, what's the pathway of COVID-19 and the science behind it of getting infected?
Well, I'm going to try to make this reasonable for people to understand without. So once somebody gets exposed, the virus attaches to a certain receptor within your airway that's called the ACE2 receptor. And then it starts multiplying in respiratory cells. The initial phase of the infection, the fatigue, the early coughing, the fever, and the early symptoms are based on the virus multiplying. But as the body tries to fight off the virus, it releases a bunch of hormones that we call cytokines to try to control the infection. And the more serious late phase of the illness for people who are at highest risk for dying is having an over-enthusiastic immune response, right? So what they call a cytokine storm that is triggered by the virus replicating. So the approach to treatment varies depending on the time in which somebody is identified as being infected. So early on, antiviral drugs and the monoclonal antibodies would provide much more benefit than probably later when somebody is already sick and in an ICU on a ventilator, where cutting down the inflammatory response, in addition to something controlling the virus replication, provides the most benefit. So I hope that's enough detail for everybody. Or hopefully not too much.
Thank you. And with that said, with the case numbers going down, is the county doing contact tracing? Can you describe that effort?
Absolutely. We've been doing contact tracing from the beginning because that is the best way for us to be able to identify all the people that may have been exposed and make sure that they get the appropriate evaluation, testing, and have them go on quarantine. So basically what happens is when we get a report of a case, that report has contact information, especially we look for the phone number and contact the person and try to talk to them and find out where they have been in the last 2 weeks. Have they been around anybody who was sick? And that helps for us to identify where the person could have gotten infected, especially if they went to a large event and they find out that there are other people who attended the event that also got sick. Usually that is what helps us in identifying where the exposure could have occurred. In some situations, it's very difficult to know because they just don't remember any unusual place they went to. They're always going to the same places and they don't recall being close to anybody who was sick. But we do know that sometimes COVID-19, actually oftentimes COVID-19 is passed on by people who don't exhibit symptoms. So in those situations, it is harder to try and pinpoint where the exposure could have occurred. And so 2 things with that is, one, once we know where the exposure occurred, it helps us in trying to find out who else could have been exposed, and also trying to find out also who the initial person was to make sure that they got tested as well. And that way, and of course we use quarantine as a way of trying to limit the spread of the virus. But yes, we've been doing contact tracing throughout. At one point, when we had really high cases, it was difficult to get to everybody because we have a short window of time when it's actually worthwhile and effective to get that information and get to the people who were exposed. But when you have over 1,000 cases a day, like we did in December at one point, it's difficult to have enough people to make all those phone calls. So in those situations, a couple of things that we did, one was to ask our healthcare providers that when they called somebody and let them know that they were positive, that they also let them know other things that they could do, such as contacting the people that they were around, and also making sure that they go in isolation. So using healthcare providers helped us. And then also we had a system that we put in place, which was used, electronic notification. And that also helped to make sure that people got notified of their results and also notified of what they needed to do in order to isolate and also to keep other people safe.
I'm going to rephrase this question. Can people see my information in the state registry? And I'm assuming the state registry is the California immunization record. And what information can they see?
Sure. Yeah. So no, some people can see it, but not the general public. So the immunization registry has been around for quite a while, and that's where we initially were putting all childhood immunizations, but we're really encourage adults to use it as well. And for COVID vaccine, it is a requirement by the state and by CDC that the doses go in a registry. In part, that's how we're able to see how many people are getting vaccinated, so we will know when we reach herd immunity. A person can go through an application process online and be able to view their own record, but otherwise the only people that can see records are healthcare providers. And anyone who's has access to the registry has to apply through an organization that they work with, and then they have to go through training as well. So the information is confidential.
While many of us are awaiting the vaccine, what is happening on the treatment front? Are there now more effective treatments for COVID?
Yeah, so treatment trials have been ongoing since the beginning. And we have several effective treatments. A drug called remdesivir is available and has demonstrated that it shortens the duration of illness. There's evidence that dexamethasone, which is a corticosteroid, actually improves survival rate. There are several other drugs that also provide some benefit. I'll mention the monoclonals in about a second because I saw there was also a chat relating to that or a question relating to that. So we do have treatments. There are a bunch of others that are on the launch pad. But what has happened is one good thing is as the number of cases go down, the number of people who can enroll in clinical trials goes down. But even before the cases were going down, we started seeing people being more reluctant to get into clinical trials than they were at the beginning because they didn't really have a lot of other treatment options beyond being in a trial. And so we were a reasonably high enrolling site in some of the early studies, and we have not had a lot of patients really demonstrate much interest in subsequent trials. Those are for the inpatients. For outpatients, we also have clinical trials, mostly including monoclonal antibodies, but there are some pills also that are direct antivirals that are being studied for outpatients. As far as whether local hospitals are using the monoclonals, I can't speak for all of them. We do. We've given monoclonals to over 100 patients, and we have a system set up so that patients can get them relatively quickly. And once they're identified, the monoclonals have changed because some of the variants that are circulating in California are not as effectively killed by the first monoclonal that became available, the one from Eli Lilly called bamlanivimab, and that isn't even being distributed in California anymore. So we're keeping up with that and we're making the changes. One other thing is we just closed a clinical trial at our site, and the data hopefully will be analyzed and should be available in a couple of weeks using the Regeneron monoclonal combination to actually prevent infections and household exposures. And so that's something that could really make a big impact as a bridge to getting people vaccinated, is if you get exposed in a close circumstance where you might be able to actually predict that you have a high risk of getting infected. The monoclonals, which can be given like as subcutaneous injections, just like giving insulin, is hopefully will look pretty good. I don't know what the numbers are going to be, so I can't speak to that. But I know the study was locked yesterday, and so the data are being looked at.
There are a few questions about people asking about the Pfizer vaccine only protects for 6 months after the second dose that news media outlet have reported.
You know,
if this is true, how can community members or folks protect themselves? And would that mean that they have to be vaccinated yearly?
Yeah, so first of all, here's the deal. The data that came out today from CDC that said that it's 91% effective at 6 months. What that's saying is that's how far they followed people out. Remember, the Pfizer vaccine got its EUA in late November or beginning of December. I can't remember the exact time, but it was somewhere around Thanksgiving or give or take a week or two. And so you can see that they can't really even follow people out for much more than 6 months at this point. The clinical trial started in August, and so that's why you're seeing 6 months. And what that actually said is that it was just effective at 6 months as it was when they first got their EUA. That the effectiveness rate dropped from like 94% to 91%. So it was still equally effective. That means it may go out much further. Now, as far as whether people have to get vaccines more frequently, whether it be annually or every 2 years or 3 years, some of that is going to relate to these variants and whether the vaccines are active against the variants that are circulating. That's why we get flu vaccines every year, is because the flu viruses change. Even though there hasn't been much flu this year, I don't know how they're going to figure out what's going to be in the vaccine.
What is Sacramento County doing to address the differences in doses compared to other counties, such as Yolo, El Dorado, or Placer?
So each of us each county is given an allocation on a weekly basis, and that allocation comes from the state level. That allocation is based on certain algorithms, and those algorithms have changed over time. When we first started, they were based on our population of people in healthcare as well as people in long-term care facilities. Then that changed to an algorithm that put a focus on people who are working in agricultural fields. So when that changed, our allocation also changed because there are other counties that have a much larger population that are agriculture workers. Now that it has changed back to where it's based on population, I think that is part of the reason why we are seeing an increase in our allocation for Sacramento County. So whatever allocation we get, we use it up, or we are required to use it up in 1 week. So all of the doses we get, we use up in the week. One other point is that we vaccinate based on where a person lives or where a person works. Sacramento County happens to be a very large county surrounded by smaller counties, so it is an employment hub. There are a lot of people who live in surrounding counties that actually work in Sacramento. So when you look, about 20% of the vaccine that we have administered is in people who are outside of Sacramento, live outside of Sacramento, but work in Sacramento. So we're continuing to work on making sure that all the doses that we get, we are able to administer within the period. Rachel, I don't know if you have anything you'd like to.
I mean, I think that sums it up. I would just say when Sacramento County gets our allocation, whatever it is, we work really hard to get the doses out. And that's really what we're focused on. Yeah, just making sure that we have appointments available and can get them to the people that they're intended for.
What is the grace period for second doses of Moderna vaccine if someone's unable to receive it on the 28th day?
You know, I think CDC says 42 days, right? So that gives you another 2 weeks after the month. I'm only speaking for myself. I think even if it was a little later, it wouldn't be a problem. I think there's been some evidence, at least with the AstraZeneca vaccine, that if they delay the second injection, it doesn't cause any problems. In fact, they sometimes get a better response after the second dose. I think that's why in Great Britain, they're only giving 1 dose of vaccine to try to get more first doses out, and then worrying a little bit less about the timing of second doses. So officially 42 days, but if it happens to be a little longer, I don't think anyone's going to withhold vaccine, and you'll probably get just as good of a response.
How safe or risky are public or private swimming pools?
You guys seem to be looking at me to answer this. I didn't see a bunch of people jumping at their unmute buttons, and so so I think it depends who else is in the pool, right? If it's a big large swimming pool, a big large public pool with a lot of crowding, and people are obviously not wearing masks, it's going to be a risky proposition. If it's a pool at somebody's home and people are vaccinated, I think the risk is minimal, right? I think it's not so much the activity, it's sort of the venue, and then swimming with a mask on is probably going to slow people up a little bit.
Why is the reaction to the second shot more painful than the first?
First of all, I don't think it always is, but most of the time it is. And I think it is because what happens, this is related to the local immune response right at the site of where the injection occurs. And so I think that once your body has seen the first dose of vaccine, it is primed to fight off the second dose, right? That's the way the vaccines work in the first place. That's how come if you end up seeing the coronavirus after you've been vaccinated, your body fights it off and you don't have any, you don't get infected. This is the same thing. It just happens to be localized in a small area. So there might be a little bit more of a response. And since the pump has been primed, the second dose is more likely to be associated with side effects than the first, although that's not a guarantee.
Will the Sacramento County Health Department be tracking which vaccine providers will use, such as the Janssen?
I can answer that one. We do, and right now we have a lot of insight into that because we've been making the allocations, so we know exactly which provider has which vaccine. So with the transition to Blue Shield, we'll have to probably work a little harder to provide that information, but we do have it on our website. So when you go to the county website, it will say the Cal Exposa Moderna site, and now I believe it says Johnson & Johnson as well. Cal North State is Pfizer. So for the bigger sites or bigger clinics, we do put what vaccine they have. It does change from time to time, with the variants that we see and the kinds and numbers of doses that we get. So sometimes provider might have Moderna, and then they, now they have Johnson & Johnson. So, but we're trying really hard to make sure that's posted on our website. Oh, there it is. Yeah. So here you can see McClellan Park is Pfizer. Natomas, I think it says Pfizer this week. Sometimes it's something different. Some of these pop-up clinics, it depends on how much vaccine we have or what type of vaccine. We want to make sure we take enough doses. Yeah, there's Cal North State's Pfizer. So, and the pharmacies have a variety of things as well. So it's harder for us to have insight to them. We do allocate to some of them, but many of them get federal vaccine. And so we don't always know what they have. But a phone call can help too, I think, to try to ask them what they have.
So if an individual had COVID, can they still test positive 4 months later or months later if they were reinfected?
So there are two two components to that question. So first, people who have COVID can often test positive for quite a long time after their symptoms are gone and after they've totally gotten back to normal. One of our first patients was positive for 3 or 4 months after the infection. So it takes a while for your body to totally clear it. This is not viable virus, so you can't infect people, but it still can be detected with the testing. If somebody clears COVID or clears the virus that causes COVID and then gets re-exposed, there is a possibility that they could get a second infection. Those are quite rare, but they are reported, and we are aware of people. And when the genetic material of the virus is tested between the first and second episode, it's clear that it's a different virus the second time through. So, so it does happen. It's just pretty darn uncommon.
I'm sorry, I'm a little frozen over here to ask my next question. Following up on the registry, what are the data elements collected and visible in the registry?
So the doses go into the registry from the system that you were registered as a patient to be seen, just like, so an electronic medical record. So, and it pulls enough data to find your record in the registry. So it's your name, date of birth, and address. And then it's going to have the dose and the date that you received it and the location that you received it in. And it also includes the lot number, so some important information that you would want to have in a medical record. The lot number, the site that it was given, and the person who administered it.
If you could get a vaccine in another county, should you?
Each of the counties gets enough vaccine based on the algorithm. So if you live in Sacramento, we prefer that you get your vaccination in Sacramento, unless you work in another county, in which case you can go to the county that you work in and get your vaccination there as well.
Autoimmune disease like GBS, SJS, SLE, HSP, Kawasaki disease are known to be exacerbated after vaccination. Does any of the COVID-19 exacerbate these diseases?
So right now, I don't think there are enough data to support this. So, so the first question, so GBS stands for Guillain-Barré syndrome, which I think a lot of people are concerned about with vaccines. And for those of us who are older, you remember when the swine flu vaccine in '77 rolled out. There were a handful of cases of Guillain-Barré syndrome. That was the real link. There's been no link that I'm aware of at all, and I'm not aware of cases of Guillain-Barré syndrome relating to COVID vaccine. Regarding the immune suppressive illnesses like lupus or Sjogren's syndrome or some of the other things that are listed there, some of those people, if they were on immunosuppressive medications, particularly the ones that they painfully advertise all the time on TV, I think they were excluded from participating in vaccine trials. So whether they get a good immune response and whether they get protection is maybe a bigger question than whether the vaccine would actually make things worse. Kawasaki's is interesting, and I'm not sure how to answer that because I'm not a pediatrician. But that complication of COVID that's seen in pediatrics called MIS-C is very similar to Kawasaki's disease. And so I don't know what exactly to say about that, except that if you have Kawasaki's, you probably would rather be vaccinated and not get COVID. And so that would be my impression as an adult doctor, but I can be much more strong in my statements about the prior diseases. But I think I covered all of them on the list.
Thank you. I'm going to have my colleague Liz help me facilitate because I am glitching a little bit. So I'm going to take a pause and pass it over to Liz.
Hello there. All right, so we have a really good question here, which is, when will the high school sports athletes receive vaccines and consistent testing, since there are 47% per this community member that have COVID?
I'm not sure where that number comes from because it's not supported by the data that we have in Sacramento. But what I can say, as I mentioned at the beginning, is that we have seen a slight uptick in our cases, and it's related to youth sports. So we have been working with the schools and the coaches to make sure that they do follow that they have a protocol in place and that they do follow it. And part of that protocol is actually testing. So that the testing has to be arranged by the school or the coach, but the state has provided assistance in terms of the specimens can be sent to the state lab. So if the school or the coach needs information on that, they can go to our website and get that information. Or actually Liz is our coordinator for testing and has been helping the schools in making sure that they get their testing protocols in place.
All right, great question. We love testing and just keeping the testing train moving so that way we can continue to stay safe. So we appreciate that question. We have a question that's really timely. Will there be another surge when the UK variant hits? And how soon is that surge expected?
So there are a couple of things. Of course, we are watching the numbers because we are seeing an increase in some of the other states. We are hoping that if there is an increase, it will not be the same as what we saw in the wintertime. But the big difference this time is that we do have our residents in long-term care facilities vaccinated, and that will help go a long way in protecting them. Because in previous surges, what was happening is that we would have cases start to rise in the general public. And then once it got to the long-term care facilities, we had the large outbreaks because in a congregate setting where you have a large number of people living together, it was difficult to control once the disease was introduced. But this time around, they are vaccinated, so that is a good protection. We already do have the variants in California, and we are monitoring. And that's why even for people who are vaccinated, we are asking that you continue to follow the same guidance in terms of using the face covering and 6 feet separation, because of these different variants that are popping up.
No, if I could add, I think the expectation of people who are virologists working in this area is that the B117, the UK variant, is going to end up becoming the predominant variant in the United States. It's going to outcompete even the variants that we call the California variants, which are the primary drivers right now. But on the positive note, these vaccines are very effective against the UK variant. That should keep people safe. And then if people are smart, we should not see a big surge. And I think that's the critical right now. I know we've discussed this on prior town halls, but you know, it's been a long time. Everyone's exhausted by this. I'm telling you that I'm exhausted. But being right, waiting another couple months till the vaccine has a chance to really roll out before you start really trying to get back to totally normal life is really going to help in keeping these surges from happening. You know, the highest risk people are becoming protected, but there are a lot of people in the population who are not vaccinated yet, and you just got to be smart about it.
Thank you. All right, so we have an individual who is retired and is interested in traveling. And you know, there might be many people who are interested in traveling, so I'm sure the response will be helpful for a lot of community members attending. But what processes should they follow when they're considering traveling outside of California and considering getting the vaccine?
So the state actually recently released the new travel advisory, which states that if it's a travel that is required either for travel or necessary travel, that one is that you do take a COVID test prior to leaving, and that when you return, you take another COVID test and that you quarantine. And this is regardless of whether you are vaccinated or not. If it is travel for leisure, our advice is that you put off that travel until we get to a point, as Dr. Cohen mentioned, where we have more vaccine coverage and we're able to get these numbers even lower.
Great. So we have another question about the Johnson & Johnson vaccine. When the Pfizer and Moderna vaccines became available, I read that California did another task force review at the state level to even further evaluate the safety and effectiveness. Was this step taken with Johnson & Johnson?
I am not aware of that. I don't know if Dr. Cohen, you're aware of any additional review.
I don't know the answer to that either.
I know that one. It was. So the Western states do have an advisory committee. It's Washington, Oregon, Nevada, I think in California, and they did for all three vaccines met, and I think you can find it online, the reports, but for all three, they decided that they were safe and effective and recommended the use. And so Johnson & Johnson, before we received our shipments, or right after, I think we received that notification.
Great. So we have had a lot of people in past conversations ask about volunteering. So there is a community member who signed up to volunteer through Sac County and My Turn. They haven't heard anything back for about a month, and they're just wondering if they should assume that non-medical volunteers aren't needed at this time.
I can answer that one. So I wouldn't say we don't need volunteers. We have always relied really heavily on volunteers for our flu outreach, and we have been enrolling people to volunteer and are using volunteers in Sacramento County, both through Sacramento County and through the medical, Sacramento County has a medical reserve corps. We have a lot more work to go, and we are using a lot of volunteers, but as time goes on, I think everyone will have an opportunity. So I would encourage people to be patient. If you haven't heard from us, reach out again. We have a lot more outreach planned, and community pop-ups and events where we will really need those volunteers, and they are always fantastic. So for Cal Expo, we have had this opportunity from the state to have National Guard and also a team of nurses that came to us from the state. So we didn't need quite as many volunteers there. So I think the need is definitely still there. We're very appreciative of people's willingness to volunteer, and just be patient. We will have an opportunity for you, I'm certain.
Great, thank you. So we have a community member that's interested in understanding so there's this term that we hear often, slowing the spread. And so they're wondering, are there unintended consequences of slowing the spread? because it gives the virus time to mutate. So maybe just breaking down that term a little bit more, because it can be a little confusing. Are we slowing down COVID? And does that give it more time to develop?
I can start and then, go, Dr. Cohen, do you want to
I
start?
was going to say, I think that means exactly the opposite. And
Okay.
so I think maybe that's what's confusing people. So when they say slowing the spread, they mean get the number of cases down. Looking at it in the reverse, the more people who are infected, the more likely there are for variants to either develop or be transmitted from person to person. So slowing the spread stops the number of cases, it lowers the rates, and therefore it will actually decrease the spread of the variants. That's the race, right? The race is vaccinate and get people protected, stop the virus from spreading, and then we get the variants under control. That becomes not an issue anymore, right? When there's
Right.
nothing circulating.
Yeah, and I wanted to add to that. That's a very perfect description, because actually the virus mutates when it replicates. So that means that the higher the number of cases, the more chances for it to replicate and the more chances to mutate. So when we're slowing the spread, when we have fewer cases, there are fewer opportunities for the virus to replicate and fewer opportunities for mutations.
Great. So appreciate whoever asked that question, just clarifying some public health terms, which is awesome. So we have a community member here who is providing a description. They had 2 family groups related to him that had COVID symptoms and positive tests among the adults, but negative tests among the children. In both cases, they were living in small settings. So they're wondering what gives. Is it possible that the COVID test is less sensitive in children? What's going on?
So I don't know whether the tests were all done at the same place, whether they all used the same exact testing methodology. And then, although those are teenagers, at least as I read it in the chat, a lot of times people are less enthusiastic about getting a good deep sample from kids than they are from adults, right? Particularly younger kids get a little bit wiggly and make it a little bit more difficult for people to get these samples tested. So that's a hard question to answer. Given that they all had symptoms, they probably did all have COVID-19. And it's just a question of if they were all tested in the same place, then there was probably something in how they were collected in the kids.
Great, thank you. So how is coronaphobia similar to other phobias, such as hypochondria, according to the diagnostic criteria in the DCM and the Merck manual?
I don't think I can answer that. I'm not sure how that of those terms. I know that there are people who have concerns about having parasite infections that don't, and we see those not infrequently in our clinic. That have what I'm assuming is being called parasitophobia. We call it delusional parasitosis. But I've not heard of people thinking that they have coronavirus all the time that don't. But maybe I'm just not seeing that in the way I'm practicing.
All righty, thank you. So we have a community member that has a fellow veteran friend who's been treated for prostate cancer experienced a rise in their PSA level after receiving COVID vaccine. This person hasn't heard of such a side effect, but wanted to check in to see if we've heard of such a reaction.
I have not, and I think that's part of the reason that you have to do these big randomized clinical trials, because sometimes things are just coincidences, and you don't know whether it's caused by the vaccine, whether it's even associated with the vaccine, when you only have one person. And in the clinical trials, I'm pretty certain nobody's testing PSAs on everybody. And so it's a little bit hard to make that assumption, but I wouldn't attribute anything to one case.
Got it. So we have a last question, which is great because we actually started out with this topic around high school sports. So the question is, what percentage of high school athletes that test positive are also symptomatic? Do we know that?
No, we do not have that information. As I mentioned, what we have seen with the small outbreaks that we've had is that usually the index case or the first case has mild symptoms, and then through testing everybody else, they do find additional cases, but we don't have a read on how many of them are asymptomatic.
Great, thank you. So those are all our questions for tonight. Dr. K, Rachel, Dr. Cohen, is there anything that you want to add before we close out our time together?
Well, just want to thank everybody. And I think this is only the second time that we've actually been able to get through all the questions.
Woo.
So I'm hoping that that means that we are getting through and answering all your questions and providing you with good information. So thank you again for joining us.
Yeah, I would echo that. I appreciate how thoughtful most of these questions are, or at least the ones that are directed at the medical people. And it's really been a terrific experience. I appreciate being invited, even though I think I talk too much.
Great. Well, thanks everybody for joining. You'll get an email about 24 hours after this event. It will include a feedback survey. If you have any feedback for us, it will also include a YouTube link because I'm sure you'll want to hear Dr. Cohen's comments twice. I know I'm going to watch it again. And we really appreciate the time that we've had with you and hope to see you again soon. Thank you.